The Justin Trudeau Liberals had spent $15.3 million of a $54 million advertising campaign budget to shape-shift the behaviors of 18 to 24-year-olds to ensure that they complied with the safe and effective COVID-modified RNA injections. Exclusive government documents obtained through access to information requests by us at Rebel News have shown that the government not only paid out tens of millions of dollars to shapeshift your behavior and entice young, healthy adults to comply with injecting a novel, still then in clinical trials, pharmaceutical product with waived liability.
These agreements require employees of the Government of Canada that access these documents to sign confidentiality agreements. And why is that? Why is there much more redactions, as my colleague said, in these documents than in other documents? It's because these documents were signed at the beginning of the pandemic, when everybody was desperate for vaccines, when companies were being told to rush vaccine production, do testing in an unprecedented way, in a way they normally don't do it. So these companies were exposed to way higher liability, putting their products on the market than they normally would, because they didn't do the type of testing that normally takes these drugs years to come to market. They did it all in less than a year. So that's why these companies said, if I'm going to deliver you this product that I haven't tested in my normal way, I want to have different conditions. And with all countries around the world competing with each other to get these, the countries had less leverage than they normally do. For example, if we were entering into flu vaccine contracts, or monkeypox contracts, or other things that were normally available, this would be a different issue. But these are already signed. They were signed at a time the government didn't have that leverage in negotiations. We just wanted to sign as many vaccine contracts with as many producers as possible because Canadians were desperate for vaccines. And in the end, it worked out. We got vaccines, and we were one of the countries that got to vaccinate everybody the fastest.
The first campaign of this nature was titled COVID-19 Public Health Measures During Vaccine Rollout and was launched in the late summer of 2021, set to run until March 31st, 2022. It was meant to inform Canadians of the public health measures they need to follow during the lead up to and rollout of a free COVID-19 vaccine to protect themselves and their communities. While the Public Health Agency of Canada confirms that in March 2020, they launched an extensive $30 million national public education campaign as part of its overall risk communications strategy around COVID-19 with the aim to inform Canadians and raise awareness of public health measures and actions Canadians can take to protect themselves and others until a COVID-19 vaccine or treatment is developed and available. But that amount ballooned almost twofold, with the total campaign media buy increased to $54 million. Public Health said that media planning and selection is required to reach a significant percentage of the Canadian population to increase awareness, motivate interest, and generate engagement with federal information and resources about the virus and ongoing public health measures and requirements. They use traditional and digital media to deliver the highest potential target audience reach and influence, using mass and narrow audience targeting approaches. Despite their ballooned $54 million budget, Public Health called on North American media suppliers to provide an in-kind ad grant or donate free media space to them for public service announcements on COVID-19 measures as part of their corporate social responsibility activities. The Public Health Agency even went so far as to say that there are unique paid and earned media placement opportunities, suggesting a deliberate strategy to exploit advertising channels, both paid ads funded by taxpayers and earned through free publicity and media coverage to target Canadians. The use of unique implies that these are novel or opportunistic methods, the likelihood that they were seeking to take advantage of and capitalize on behavioral shifts during a crisis. Never let a good crisis go to waste, as they say, and they'll do this by targeting Canadians who are increasingly taking up outdoor activities, such as walking, as a chance to intercept people with this messaging. This position assumes the government or agency knows what people are doing and sees it as a lever for influence where people simply out for a walk may encounter pandemic messaging. This kind of language may sound vague, but we saw all throughout the COVID handling that messaging far exceeded basic public health reminders like wear a mask and crossed over instead into more coercive or repetitive slogans designed again to shape your perception rather than just inform you. Take the loudspeakers in the grocery store as evidence that reminding you to stay home and save lives or accept the new normal or get vaccinated. They were actions straight out of George Orwell's dystopian surveillance state novel, 1984. The disturbing implication of all of this is that taxpayer money is being used to strategically connect with citizens in their everyday lives, bombarding them with government-approved messaging when they're simply trying to enjoy things like a walk, which is inherently non-consensual. So is this purely informational or manipulative? Regardless, the campaign was expected to have multiple sub-campaigns with specific creatives and media plans to responsively support federal organizations or reach different segments as needed. In case we were unsure whether this campaign was in fact informational or manipulative, they outline here that one of the main objectives was to educate Canadians on how to protect themselves and others, in brackets, behavioral change, including symptoms, proper hygiene, hand washing, cough and sneezing, physical distancing practices, and any forthcoming preventative advice. Now, that term educate seems neutral, but the line between education and persuasion blurs when messaging is repetitive, emotionally charged, or leans on fear, as was part of this campaign. Look at this.
It all starts with one small action, but even the smallest action can create a ripple. If enough of us do our part by getting vaccinated, that ripple can become a wave. We can all help get there by getting vaccinated. A message from the Government of Canada.
We do everything we can to keep our kids safe. So how can the COVID-19 vaccine help protect them? COVID-19 vaccines can help keep children safe from severe illness and potential long-term effects of the virus. Millions of children in Canada and around the world have already been safely vaccinated. Help protect your child. Book their appointment at canada.ca/COVID-vaccine. A message from the Government of Canada.
Vaccination against COVID-19 can help kids get back to being kids. Help protect your child and those around them. Book vaccination appointments for eligible children in your family.
Former drama teacher and now resigned Prime Minister Justin Trudeau piled on the sentiment, sharing that he enticed his own kids with treats to get these novel injections, and drew on some sort of strange parallel between this experimental civic duty and future voting patterns and even volunteerism.
I'm glad to be here as Prime Minister talking about how important it is for all Canadians to get vaccinated, but I'm also going to be playing the role of a dad of a 7-year-old who is going to get his vaccine this afternoon with me, and we're very excited about that, and I'm happy to share my perspective. First thing we got to know is COVID-19 isn't safe. It's dangerous. We need to keep protected from this terrible disease that has killed so many people in Canada and around the world and gotten others really, really, really sick. So that's why we've worked so hard on getting vaccines. But we all need to make sure that things like vaccines are safe for Canadians. And I can tell you that around the world, different countries have health scientists who look very carefully at the vaccines to make sure they're safe, to look at all the tests that have been done, to examine them carefully. And of all the different agencies around the world, Health Canada is one of the very, very best. So Canadians can absolutely trust Health Canada and all the scientists and all the doctors who've looked at these vaccines and concluded without a doubt that the best thing to do to keep you safe from COVID-19 and to get through this as a country, as a community, is to get vaccinated, but also, encouraging kids to be doing everything they can to protect their grandparents, protect people in the community who are vulnerable, protect our health systems from getting overwhelmed. It's never too early to encourage our kids to look out for their neighbors and look out for each other. And the best thing we can do through that is making sure that everyone who possibly can gets vaccinated. I know I promised my kids treats after they got their vaccines. You are going to have to wear a mask still sometimes, but the masks are going to work much better when more and more people are vaccinated. So it's all part of keeping ourselves safe. The idea that it's too big for you to make a difference in is wrong. You can make a difference in the big picture by doing the right thing. And if you get them vaccinated, if they choose to get vaccinated, if they participate in that, that sets a pattern of engagement that will extend to volunteerism, to voting, to helping out each other. That sense of responsibility for your neighbors is something very precious in Canada that we can model for our kids and have them lead the way on now that vaccines are there from 5 years old plus. So it's an exciting and important time. And as always, we need our kids to be leaders, not just tomorrow, but today, right now.
According to the objectives of part of this $54 million endeavor, all of this was, of course, meant to motivate citizen advocacy and amplification to share credible public health information, which would help to limit the spread of mis- and disinformation. The primary target audience of this not only included vulnerable populations such as older Canadians who are more at risk of severe COVID illness due to chronic or underlying conditions, but also youth and young adults aged 18 to 24, not because they were some sort of public health risk or arguably at risk at all, but rather because they may play down the seriousness of the situation. And so the Public Health Agency of Canada sought to relentlessly compel and seduce them into submission, radicalizing them with industrial strength mind control techniques and unrelenting propaganda to radicalize their minds, reshape their behaviors, and elicit an inferno of emotional responses. They go further, detailing that males under 35 who may be dismissive of public health measures as prime candidates for the psychological onslaught, aiming to crush their skepticism and lure them into unwavering compliance. In the end, the Liberals spent $54 million on an advertising blitz lavished on reshaping the minds of Canadians, particularly the young and the skeptical, which reveals a bureaucracy not just bloated, but dangerously overreaching. Picture a pandemic so deadly and so pervasive that it demands tens of millions in taxpayer-funded propaganda to coax compliance from a population already weary of fear-mongering slogans and Orwellian loudspeakers. Was this truly about safeguarding public health, or was it a calculated obsession with control cloaked as concern? When a government spends more on manipulating perception than empowering choice, the line between education and coercion doesn't just blur, it vanishes. For Rebel News, I'm Tamara Ugolini. Thank you to your generosity and support at rebelinvestigates.com. We were able to file these kinds of access to information documents and keep the microscope on government accountability alive and well. If you'd like to facilitate more of this kind of journalism, please head over to rebelinvestigates.com and consider chipping in there if you're able to. Thanks so much for your support.